Dr. Sterling, just from the point of view of the patient, what preparation is required before a UFE procedure, and what should they expect will happen on the day of a UFE procedure?
Okay, so what happens the day of the procedure is patients are going to come in on that day of the procedure. Generally, they're not going to have had anything to eat or drink for about 8 hours before the procedure, and that has a lot to do with the sedation that we're using during the procedure. They're going to come into our pre-procedure area where they're going to see the physician, they're going to see the nurses and the staff, they're going to be asked questions, standard questions when coming into any medical facility, and then they're going to get an intravenous catheter that's put into one of the veins in their arm so they can get the sedation. Then they're going to go into the procedure room. And this is a sterile environment where they're going to get a little sedation, and then the staff is going to start to basically clean the skin, and we put all the special drapes on, because it's a sterile environment, onto the top of the leg. And then when the procedure happens, the procedure itself can take anywhere from 45 to 90 minutes to perform, average probably an hour. And at the end of the procedure, that catheter that we use, that I showed in some of the examples, both the robotic and non-robotic procedures, comes out, and then the patient will keep their legs still for a few hours so that little hole heals. And then they're going to be in the recovery area, and they're going to get some medication for pain. Everybody has their individual cocktails of what they're going to use. We do use a patient-controlled analgesic pump, where patients actually are giving themselves the pain medications, and we find that patients require a lot less. And after that one-night stay in the hospital, they're going to go home the next morning. So someone's going to need to take the person home. And that's really the experience. And then they get their follow-up appointments and medications to go home.